There are other certain chemists who give a shit and want to keep the toxicity as low as possible, who will measure out the benzobenzoate according to the compound. What is up, everyone? It's Russo. I hope everyone is doing well. Today's ASMR sip is a fresh bottle of 1907. Coupon code Russo. Seal just broken. Ooh. ASMR spritz. I'm still down bad. Again, everyone comment intelligent. Look at this. I still got enough for the spritz. Intelligent Elephant, coupon code Russo, Young LA, coupon code Russo. Today's rant is going to be, is Pharma test the same as underground test? So I'm going to go into a giant elaborate rant, and this is a plug video for my testosterone replacement therapy company. Check out Elevate Alternative in the description below and fill out a contact request. Remember to get on the list because I think it's like a month and a half booked out, and you'll get a free consultation with a licensed physician assistant with, again, a multitude of compounds. If you want to see the compound sheet, DM me on Instagram at Russo Lifts and I will hook you up. Just because you think you need TRT doesn't mean you're gonna get TRT from them, so remember that. And it's more about optimizing your health, blood work, and that they don't give out, you know, massive dosages, right? It's a TRT clinic, so just keep that in mind. I've been getting a lot of questions like, hey, is there an actual difference between underground gear versus pharma gear? And the answer is yes and no. So if you have a very good underground lab that gives a fuck and has a biochemist that, again, cares about the health of the customers and the reputation of the UGL, could be the same if not better, because I've seen pretty underdosed pharma a couple times, but most of the time pharma's on point, and I've seen, again, slightly overdosed underground where the solvents are actually in the right ratios. And that's the big difference, right, is the solvents. So there's benzobenzoate and benzyl alcohol. That's the way they get the powder to suspend in the bottle. And then there's carrier oils. So certain people are allergic to different types of carrier oils. Believe it or not, my girlfriend Andrew is allergic to grapeseed oil. So if she decided to, you know, transform into a dude and injected a bunch of grapeseed oil, she would immediately have a horrendous, life-threatening allergic reaction and would have to go to the hospital, where, again, pharma grade gear doesn't use grapeseed oil. Now, me personally, I prefer grapeseed oil because it flows better, it's less hard to inject, and overall there's like less lumps for me personally. But again, person doesn't know they have a grapeseed oil issue. They're wondering why they have this giant red welt on their thing, and that is from the different carrier oils. And there's peanut oil, I'll have Andrew throw up like 10 different carrier oils. There's not just one, and normally the underground will list what carrier oil they're using, so that's not really a big deal. The big deal is solvents. So believe it or not, most of the side effects or toxicity is actually from the solvents, right? You have benzyl alcohol in there to stop it from breaking down and you getting an infection, to keep everything sterile, and then you have the benzobenzoate that's holding the compound in suspension after you heat it up and brew it. Problem is, right, each steroid has its own recipe of the minimum amount of solvents needed to hold the oil and keep it clean. The problem with underground, if you don't give a fuck, is that the chemist that's there that day is gonna just be like, blanket dosage the solvents. So you like, they'll be like, oh well, I'll just use the same solvents for this compound as this compound, where the other compound could technically be made healthier with less solvents if he followed the exact ratios. They start blanketing the solvents in high amounts, right? Because they don't care. They're just trying to make as much gear as possible to sell it. They don't give a fuck about following each individual recipe of each different compound. Like, imagine you're making 5-6 different compounds, all have different recipes, but you're just like, fuck it, I'm just gonna use more benzobenzoate than I actually have to, just so I know it all suspends, where it's like there are other certain chemists who give a shit and want to keep the toxicity as low as possible, who will measure out the benzobenzoate according to the compound to hold it in suspension. And this is all based on molecular weights and shit, and there's tons of recipes online to use. Each carrier oil is different with the solvents, so there's a big difference. Pharma takes all that, you know, worry out of it, because you have a FDA approved chemist making it according to how the FDA wants it in an FDA compounding pharmacy. For example, Elevate has access to multiple FDA compounding pharmacies that all make the testosterone cypionate the exact same. But to say that UGL is bad, not necessarily. You could have a very good UGL that's basically pharma quality, and that could be literally just the same, right? If you have a chemist there that gives a fuck about keeping the solvents literally at the bare minimum and gives a fuck about using carrier oils that don't cause allergic reactions, or at least listing the carrier oils used on the website, so you know if you have prior allergic reactions or stuff, you can avoid certain issues, that's fine. Most UGLs don't do that. They're about making money. They're underground. They don't give a shit, and they're gonna just shove tons of solvents, and that is going to build up toxicity over time, especially for an open competitor who is using and abusing a lot of gear. That adds up. All that benzobenzoate you're putting in your body is going to make you feel like crap. So that's the difference. I don't think you should like count out UGLs per se, but you definitely need to find a good one, and it's always good to inquire if they care again what the recipe is as far as the carrier oil, the amount of benzoyl alcohol they use, and the amount of benzobenzoate. If they can answer all those questions for you, and then you can look up a recipe online that it matches and you believe them, then it's probably not much different from pharma gear. But if you are worried about the quality going up and down, if you are worried about them overdosing or underdosing their shit, then stick to pharma. You should stick to pharma for all pharma compounds. Obviously, I know people on the other side of this camera want the compounds that aren't even FDA approved, and they're searching for UGLs. This is a way to keep yourself safer, or at least know that not all gear is created equal. I will see you guys in my next video.